Today's topic is, can leaky gut lead to weight gain after weight loss surgery? What is leaky gut and how does it play a role with weight loss surgery? Just to kind of give you a little background of, what is leaky gut really? Our intestines are a large surface area. It's a super enormous surface area that actually absorbs nutrients, water, electrolytes, but it also provides a barrier from harmful substances and to kind of protect you from harmful compounds that can be then sent into our bloodstream and go all throughout our body. So that's where you want to make sure that GI tract is strong. Leaky gut is really just another word for intestinal permeability and is found very connected with many different disease states and chronic diseases and disorders. So when you have intestinal permeability, it creates havoc in our body. It creates confusion in our body because now things are getting into our system that is foreign, and it can start attacking body part organs. Can be associated with things like gut infections, inflammatory bowel disease, irritable bowel syndrome, obesity, celiac disease, non-celiac gluten sensitivity, food allergies. Those are all associated with a person having a leaky gut. You've had weight loss surgery to fix this obesity problem, but maybe there's some things we might need to do on the backside after weight loss surgery. Obesity is really associated with metabolic alterations that is related to blood sugar control, such as you're having some type of glucose intolerance, high or low, so maybe like type 2 diabetes, or you're having insulin resistance. Also, it's related to cardiovascular risks, even like hypertension, dyslipidemia, so that'd be things like your cholesterol is high or your triglycerides are elevated. Inflammation is really a hallmark kind of symptom or side effect of metabolic syndrome. It's all connected to that intestinal barrier dysfunction or leaky gut. There's actually a gut bacteria-derived compound called Lipopolysaccharides, or LPS. This is something that our gut lining has, and it's identified as kind of a negative thing when it's elevated. So the more LPS that you have, the more obesity, the more disease and metabolic problems you're going to have. So that healthy intestinal lining acts kind of as a barrier to prevent that LPS from doing damage. A high LPS plasma level is defined as metabolic endotoxemia. So that's just kind of the scientific term of that's used to kind of describe when this is out of control. It was also found that the metabolic endotoxemia positively correlates with several markers of cardiovascular risk factors, like triglycerides, cholesterol, glucose, insulin, all those type of markers. It's connected with that too. So the higher this LPS, or the more metabolic endotoxemia that we have, the more likely we're going to have problems with diabetes and heart disease and obesity. So all those things are making our health worse and making it harder to manage our weight. So if you've had weight loss surgery and you are struggling with a regain, or you're struggling with a weight loss stall, or you're just way off track. So what are some of the causes that can contribute to this metabolic endotoxemia occurring where we have leaky gut? So chemicals, so that can be things that we ingest with our foods. Also things like medications, so that would be NSAIDs, even PPIs, so proton pump inhibitors, things like Prevacid, Nexium, omeprazole, all those PPIs that a lot of weight loss surgery patients are prescribed, and these medications contribute to leaky gut. That's what we want to get away from. That's what we want to try to find solutions to those problems so that you're not going from one pill to the next pill. We've shown with Roux-en-Y, gastric bypass, duodenal switch, long limb Roux, all these have been shown that they have increased leaky gut. And there are some studies that will show improved intestinal permeability. Right after surgery, there's some showing that the increase starts after 6 months. There's another study shows that the leaky gut starts more after 12 months. So that is kind of a window of time. Most typically when they come back and they're several years out, they've been dealing with it for a while and trying to manage it on their own by going to different doctor and test and pill, and nothing seems to be working. So then they end up back at the bariatric center. They'll get sent back saying, hey, somebody needs to kind of check and see what's going on. Their GI tract is a mess and something's up, and they are struggling. So some things that you can know that you might already have leaky gut. So let's cover some of those signs. Diagnosed food sensitivities or allergies, or you just feel bad when you eat certain foods. That is one thing that if you're reacting to foods, or you already have diagnosed food allergies or food sensitivities, that is a sign that you have a leaky gut. Also, if you have a lot of digestive issues, so that's like gas and burping, bloating, constipation, diarrhea, abdominal pain, just all these digestion and stomach problems. Another one is skin issues like eczema, dermatitis, psoriasis. All those are signs that there's something going on in your gut. And then also nutrient deficiencies. So if you're having especially low vitamin A, low zinc, low vitamin D, those are all signs that are connected to leaky gut. And also maybe you've been diagnosed with any autoimmune conditions. So things like Hashimoto's or Graves' disease, rheumatoid arthritis, diabetes, celiac, even small intestinal bacterial overgrowth. SIBO is prevalent in obese people about 15% of the time. And then after weight loss surgery, they find it to be about 40%. So there is an increase in SIBO with weight loss surgery, and that is a sign of a leaky gut. So those are things that you can kind of think through and say, hey, am I having a lot of gut problems? Am I having reactions to food? Am I noticing weird things on my skin now? Or maybe it's just, you just feel bad. So some of the things that you can do that are going to help improve the scenario and figure out if you need to go a little deeper. So start with the basics, and those are things like fruits and vegetables. Whole, real fruits and vegetables are going to be your friend, and they are your protectors. Also fermented foods, so things like kimchi, the fermented sauerkraut, and those are the only, you find those in the cooler section at your health food store. Even something like kefir, which you can find by the yogurts, and it's got lots of good healthy live bacteria in it. Then also taking probiotics. This is another great way to kind of build up that intestinal barrier and re-strengthen it again, as long as you're eating all those good veggies that will help grow that. And that will be also the prebiotics. So probiotics and prebiotics. So you would want both. And then also digestive enzymes. Those are also things that you can take to help your body break down the foods like it's supposed to. So when it gets to the digesting and absorbing part, it has more of the raw material to do the job. And that kind of gets you through until you can heal that intestinal lining and improve that barrier function. Some things that will actually heal leaky gut is collagen. So those collagen proteins are good. You just want it to be a collagen peptide so that you are getting the purer form of collagen. Also something like colostrum, zinc carnosine, or glutamine is another way to heal a leaky gut. So you want to incorporate, it's kind of like the whole package deal. You can't just do one thing and not change your diet and, still keep eating all the junk, the high sugar foods and, the chemicals and the medications. And you can't keep doing all that all the time and expect to heal a leaky gut. You really do have to, take a window of time and really take everything like you're supposed to and eat all the foods and really get that army going of good, and then you'll be able to heal it and kind of get on the road to recovery. And, getting over leaky gut, it is something that you have to work at and add in all aspects of it.